Alrighty, so in my research, I explored the effects of chemotherapy on the long-term quality of life in females under the age of 10 with acute lymphoblastic leukemia. And before I go on, I just want to apologize. When I put it in slideshow mode or make my screen bigger, my webcam disappears. So I'm just going to leave it in this format. I know it isn't ideal, but cool. So, my original PICO question was comparing the long-term quality of life in females under the age of 10 with leukemia that were treated with chemotherapy as opposed to radiation. But when I tried researching this, I realized that I needed to revise my question to be more specific to just one aspect. So, the question I focused the remainder of my research on throughout the module asked how chemotherapy as a treatment affects the long-term quality of life in females under the age of 10 with acute lymphoblastic leukemia. I found exactly 2 articles on PubMed that matched the mesh terms I put in, and I used words such as female, children, chemotherapy, and quality of life to yield the results. I found the advanced search to be the most useful because when I tried just keywords, I didn't get any articles that seemed to be relevant to my question. And then these are the 2 articles that I referenced in my research. In Article 1, which discusses the treatment of young adults with Philadelphia negative acute lymphoblastic leukemia and lymphoblastic lymphoma with hyper-CVAD versus pediatric-inspired regimens, argued the point that pediatric-specific treatments often yield results that would have less of an impact on young patients' long-term quality of life than hyper-CVAD treatment. In order to make this point, the article compared the impact of the 2 treatments on several different factors that play a role in the overall quality of life of a person. It found that hyper-CVAD had more of a negative effect on immune system function, had a higher mortality rate related to the treatment, is more toxic to the central nervous system, has a greater than 80% chance of making females infertile, is found to have a link to cardiomyopathy, and also highlighted that secondary cancers are commonly found in individuals treated with hyper-CVAD than the pediatric regimen. It also stated that more patients treated with hyper-CVAD were hospitalized post-treatment again for one reason or another when compared to patients treated in other ways. In patients treated with the pediatric regimen, there were more cases of pancreatic dysfunction, but that's the only negative that the article noted. The article also briefly touched on the data about the treatments that affect hospitals. So the pediatric regimen is favorable because it's significantly less expensive and easier to administer than the hyper-CVAD treatment. And Article 2 was a prospective longitudinal research study that observed the physical, emotional, and social impairment of patients throughout the treatment process of acute lymphoblastic leukemia with chemotherapy. This study had a high participation rate of 82% and eliminated bias by observing patients enrolled at 31 different institutions. The graph shows that the results they found illustrate the highest level of impairment in all 3 areas measured about a month after diagnosis, and then they all seem to slowly taper off, except for this social aspect here, which almost seems like it goes back up a little bit, but their generalization came from these results right here. And moving on to the discussion. So both of these studies are relevant to answering the PICO question I created because they explain the effects of chemotherapy on young children from different perspectives. This was helpful because while the data was different and did not match the question I asked exactly, it was still very useful and provided me with adequate information to be able to make generalizations and conclusions. This research showed that chemotherapy has its pros and cons on children's developing bodies, but so do other treatments. When compared to other treatment options, chemotherapy's effects are significantly more mild than other options. It is also important to highlight that there are resources available for patients and their families dealing with a cancer diagnosis and navigating the treatment process regardless of what treatment is used. And both studies seemed pretty valid, but I noticed that the second study flat out said that some possible limitations of it could be that parents did not fill out the provided material to get results back to the researchers. And this lack of compliance could have caused there to be inaccuracies in the overall trend of the data. Due to the patient's parent or parents having to self-report the results, there could definitely be bias included in their responses, intentional or not. Parents see their children differently from the medical perspective than researchers or medical professionals do, which could definitely sway the results. And here are my references. And before I close out this video, I just wanted to thank everyone involved in this program for the work that they put in to make it possible.